One of the things I admire most about Dr. Washington and what she's been able to create for ATW is that so many of us, particularly African Americans, have the same lived experience that we try to combat. Family members and others impacted by health disparities and health inequities. Dr. Washington is one of those rare individuals that turned her own lived experience and the lived experience of her family, particularly the untimely death of her father, into an action-based organization that really sits at the intersection of intervention and prevention. When you think about the impact that ATW has had on advancing equity in this space, it's truly in the impact that she's been able to have. From the amount of federal funding that she's been able to receive, from the amount of other Black women that she's been able to mentor in other organizations, to also the technical assistance she provides and always being a lending hand, but really demonstrating to young entrepreneurs, particularly women of color, African American women, and people of color in general, that it is possible to have an equitable seat at the table. And to not just have that seat, but to make sure that others have equity because you have that seat at the table. And ATW has been a living example of that. One of the things that I think a role that I have as a CEO that aligns with Dr. Washington is what she lives and breathes, and that's collaboration. She always enlarges the tent to make sure that there's room for more people, and she never is selfish about the information, the ideas, nor the resources that she has. And it's that type of collaboration and an asset-based model, always assuming that there's more room at the table and that there's more resources for everyone. That type of collaborative spirit, if we could multiply that and multiply the Dr. Natasha Washingtons, we would be able to make a bigger dent in health disparities.